And with no further ado, we're going to move to our last presentation in this section. Rose Khalifa.
Well, good evening, and thank you very much for this opportunity to share my experiences and some advice regarding policies. First of all, this is interesting in that Helen initiated the presentation by really speaking to and about the refugee, the journey, and the recent policies around the refugees, and giving us some of that demographical information. And then Ali, who says that he has a challenge with his voice, he has no challenge with his voice, and certainly no challenge with the level of energy. Thank you for that presentation with regards to the newly developed public health department in the city of Dearborn. I was a person that grew up in the South End, and know exactly what you're talking about when you grow up in an environment where your backyard is basically the automotive industry and the public health impact that it has on those who reside so close to it. And so what I really wanted to do was, in my understanding, in sharing with you some of the learnings, if you will, over the journey of about 25 years. I am a nurse. And I am here with you, sharing with you the journey as a nurse and the types of things that I have learned over the years. I am the founder and the executive director of MENA, and that's a National American Arab Nurses Association, and very excited to share with you what I believe is truly a public policy or an application of a policy that we want to talk about today. So if we can go to the next slide, please. I'm not sure if you're able to click on that link. If you are, that would facilitate the rest of the presentation. If not, that information is in the upcoming slides. So one of the things that we have learned with a large refugee community, and as you serve them either in healthcare systems, public health, engage them in participating in research, in whatever capacity you want to deal with individuals who truly are struggling with language competency. As refugees, English is not going to be a language that they either know at all or that they're competent in communicating. So your biggest challenge is truly at every level is how do you engage the person you're serving, and more importantly, the family or the individual that comes with that person. Because in many of the ethnic families, you're not always just dealing with the one person. You've got to factor in the extended family that they may bring with them involved in their care. So if we can go to the next slide. One of the most important things is we do have the national class standards, clinically and linguistically appropriate services. I can tell you in my 25 years in healthcare at the hospital level, and even in public health, the many times that individuals are there to receive services or seeking services with limited English proficiency, ending up utilizing their children to interpret for them. That is a very difficult place to be. I remember walking into an OBGYN clinic, and a patient is there for their first OB visit, and their 12-year-old son was interpreting. It really is not the appropriate person to interpret. So as we know, this country has created the class standard. I should say HHS has created the class standard and is expecting any agency that received federal funding to apply those standards in their practice. It is something I recommend, whether you're receiving federal money or not receiving any federal money, that you look at ways in which to improve and enhance the communication with those who have limited English proficiency, so they may be able to receive equal quality services that others are able to when they come to through those doors. So the main principle of the class standards is to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. It's a global standard. It's not just speaking to the language needs. Remember, we talked about earlier the appropriateness of who is serving, who is intervening, who is participating in that health experience. And so we really need to be very cognizant of who is appropriate to assist you when you're dealing with an individual who has different cultures, different language, and what are those resources that you're able to tap. Many healthcare systems have been encouraged and developed policies to where they would look to identify staff who has competency either in verbal or written language of another language, so that you can tag that person for emergency needs, but you have to make sure that that individual also has medical fluency. A common mistake is oftentimes you have a colleague that is conversational or believes that they are able to speak a different language, but in reality, they may not be prepared or appropriate to interpret in a medical situation. This is not funny, but I remember a time when we had a patient that came in for surgery, and I had to be the person to cancel the surgery because the patient didn't understand what the procedure was. The person who interpreted, was not able to speak to the procedure. This gentleman was having a prostate surgery, and he thought his hemorrhoids were being addressed. So clearly that wasn't an informed consent, and we had to cancel. So public health, you're advocates, right? And we have to make sure that when we are have no choice but to leverage someone who's able to assist us with language issues, they've got to be able to speak the language. Even within that language, they've got to speak to those particular details, and they have to be competent to do that. Otherwise, you're better off just not allowing that person to engage. If we can go to the next slide, please. So the class standards are obviously grouped up in variety of different headings and focus. These three standards are around governance, leadership, and workforce. Advance and sustain organizational governance and leadership that promotes class and health equity through policy practices and allocated resources. I'm not going to read each one for you, but in this area, it is focused on the leadership has to buy into this cultural competency and linguistically appropriate services. If the highest level does not value and appreciate the necessity and the cost associated with providing services that account for cultural differences and is able to access the resources to address linguistic problems, there is a cost associated with it. The federal government can mandate certain requirements, but they're not going to necessarily fund it. And so for many healthcare systems, or even public health, they've got to work around their budget to be able to bring in the additional resources to help with meeting the class standards. And so again, the leadership has to believe in it, has to support it, and has to fund it. And so then you go to looking at workforce diversity. How do you and where do you seek individuals who are qualified for certain positions that may bring to the table an additional skill set, and that is being proficient in other languages? For example, we had changed our policies at Oakwood Healthcare at the time to where all of the residents were being asked information about languages that they're capable of speaking, and languages that they can read and write, so that they could serve as resources to one another when they had patients of different culture, different language. And at times people come to you in public health or during a visit, they have their records from another country and it's a different language. So you have got to, in order to understand that information, be able to access individuals who can translate those documents. And someone spoke about that in one of the earlier presentation. You know, there really should be resources that are at your fingertips for individuals who are proficient, medically proficient to speak another language, individuals or companies that you can access for documents that you need translated. So when you're helping someone deal with language barriers, you're interpreting. But when you are looking at written documents, you're translating, or you're getting something translated. Oftentimes, everybody interchanges those words. So workforce diversity is an expense, but it is, in my opinion, it is reducing liability, it is improving outcomes, and it is satisfying these class standards because you're able to bring in qualified individuals who have an added skill set of being bilingual and making sure that they are trained in medical fluency for their role. Again, this area is focused on the leadership, buying into, believing, and funding the cost associated with the resources and the diverse workforce. Kind of, you know, that statement that we always hear, your staff or your staffing model should mirror your customer base. So this goes to that point. Next slide, please. So communication and language, I've already spoken about that a little bit, but this really, really focuses on the importance of addressing limited English proficiency in research, in public health, and in healthcare settings. You need to be able to look at identifying, many of you may remember in healthcare systems, most healthcare systems may ask or should be asking, what's your preferred language? Versus, you know, do you have English proficiency or are you able to speak another language? I'll be honest with you, in my experience, oftentimes by the name or the individual profile, we have had people make an assumption that a person does not speak English or does not have, you know, English proficiency. Believe it or not, when I had my second child, the nurse walked in just by my name, you know, because my last name is Khalifa, made an assumption that I didn't speak English and began to talk to my husband as a person to interpret for me. That's a common mistake too. We forget the real patient and we talk to the other person who might be able to address the language issues. And making that initial assumption based on surname that that individual was not proficient. I mean, we're asking people to be sensitive, and then sometimes they're overly sensitive and they make an assumption on behalf of that patient. And so language competency and language needs are critical. It can actually, what I call it from a finance perspective, as I try to get legal to approve the additional efforts and the additional resources, the documents that need to be interpreted. It really is a cost-saving measure for the hospital in the long run, or for public health, or for anyone that really feels that we're going out of our way for an individual who came from another country and did not learn the English. And we do communicate that attitude to the person based on, I'm trying to be sensitive here. It's very common that individuals may show their discomfort or dissatisfaction with having to stop what they're doing and bring in an interpreter because that person did not learn the language. So I think in this region, that's gotten much better. But as we prepare for more refugees from other countries who are not likely, or we don't know, I'm making an assumption, but we have to be prepared for the possibility that they may not have English proficiency. That means we need to start looking at where can we find individuals who could serve as interpreters or that we can hire to be a part of the workforce to be better prepared for this refugee community that we may be getting in our backyard. I see that I only have a few minutes left. I'm grateful for the previous two presenters, but when I wanted to look at policy, the main policy was The class standards, those are federal mandates. Those are policy, protocols and standards that we have to adhere to. And oftentimes when I ask people, have they heard about the class standards or are they applying the class standards, I get a no, I'm not familiar with them. So that was I changed my presentation to focus on the class standards. So the remaining slides go over all of those standards that are required under class. And I encourage you to visit the link in my second slide that takes you straight to HHS website, at which point there's additional information there. Even the class standard information is available in other language. So I am more than happy. I provided my contact information if anyone has any questions that I can take offline since we're running out of time. Thank you.
Thank you so much, Roz, and we appreciate the perspective, the workforce perspective you bring to the table. That was valuable.